Here at 4 News Now, we are your coronavirus headquarters, and tonight, the latest on the deadly disease and its vaccine. Here in Spokane County today, there were new cases of COVID-19 and 424 people have died in total.
And while the vaccine is available to a small number of people right now, the rollout is still slow. Alex Crescenti spoke with the Spokane Regional Health District this morning. Alex.
While the Spokane Regional Health District is able to access the amount of cases, hospitalizations, and deaths, tracking the vaccine is another story. Through the Emergency Management System Clinic, they have administered 1,400 vaccines so far, but it's still unclear how many have been given out outside that system.
Currently, Washington is still in phase 1A of the COVID-19 rollout, which means only healthcare personnel and long-term care facility residents have access to the vaccine. And 1B, which is people 75 and older and frontline workers, won't go into effect until appointments start to decline. But in the meantime, Spokane Regional Health is developing a plan to communicate to the masses on how and when to get the vaccine.
We're still not in that phase yet with those individuals. And then the other strategy is just ensuring that their providers are set up and ready to go so that they can access their information on medical record systems and let them know when they have the vaccine available for their group.
Lyndia Wilson is the incident commander at SRHD. She says the healthcare providers are going to be key for calling their patients throughout the different phases. But other officials say as we move through the phases, it will become more clear what you are supposed to do.
Right now, we're putting through upwards around 300 people through the Emergency Management System Clinic this week after that health alert went out, and there's essentially no wait time.
But there is a wait time for everyone else. Washington is behind many states, including Idaho, in rolling out a specific plan for vaccine distribution. When the time comes to expand vaccination, the health district says it will work similarly to how it's working now, but on a greater scale, in coordination with Chaz Health and other partners. But it's clear there needs to be much more coordination and a lot more space.
There's a little bit of screening for symptoms and asking some very specific questions. And there's also an observation period post-vaccine, which is about 15 minutes. So that means that really staging that in a way that we still have to maintain social distancing, et cetera, makes that logistics a little bit more complicated.
I'm told the state of Washington Department of Health is working to get a vaccine finder live online that will tell you how many doses are in inventory throughout the state. But at this point, they are still working through some of the issues to get that up and live. Reporting live in studio, Alex Crescenti, 4 News Now.